Hi, I'm Jennifer Betts. I'm with Ohio Marijuana Card, and we're here today talking with Dr. Jan Cornell, a family practice doctor that has been giving recommendations for medical marijuana with Ohio Marijuana Card for the last couple of years. Today we're talking about chronic pain, one of the most common conditions that we prescribe medical marijuana for here at Ohio Marijuana Card. So, Dr. Cornell, thank you so much for taking the time to talk to us today.
My pleasure.
We're going to jump right into it. Let's talk about what chronic pain is. How would you define that?
Well, that's considered to be pain that's been present for 12 weeks or longer. That's the definition of chronic pain.
Okay, so basically around 4 months.
3 months, yeah.
3 months, yes.
Yeah.
Okay, so about 3 months. If you're experiencing pain for about 3 months or more, you're gonna be considered having chronic pain.
Yes.
Okay. And does pain need to be severe or constant in order to be considered chronic pain?
Well, the way the law is written, the qualifying condition is either severe or intractable.
Okay.
And it depends on the doctor you're talking to, really, because we got some leeway. But for example, migraine headaches, they're not generally constant pain, but they qualify because they're recurring.
Okay.
And so it doesn't have to be constant for it to qualify.
Okay. And could we maybe kind of describe what severe pain, like what is considered severe pain? Because I know that's just such a subjective thing.
It really is. And we're taught that anymore that pain is considered like the fifth vital sign, and pain level is whatever the patient says it is. That's what you go by. So that is a subjective thing, but if the patient considers it severe, then personally I consider it to be severe pain.
Okay. And so how does chronic pain affect people's lives?
Well,
because I know. Go ahead.
It used to distract them. To me, it becomes the focus of their attention, and they can't live their life the way they want to because the pain is always dragging their attention back to it.
Mm-hmm.
And so it just really interferes with people's lives. They can't play with their grandkids. They can't exercise. They can't go out and do things that they want to do because the pain is just the focus of their life.
Sure, and that can lead to other problems. I imagine just not being able to be active and depression.
Yes,
okay.
exactly.
And so what kinds of conditions might cause chronic pain?
Well, there are a lot. The most common we see, one of the most common is back pain, because that's a complex structure back there and a lot can go wrong with it. So there's a lot of chronic back pain. There's migraine headaches. There's joint pains from osteoarthritis or rheumatoid arthritis. There's fibromyalgia. There's chronic abdominal pain, often from irritable bowel syndrome or inflammatory bowel diseases. So there's a myriad of causes of chronic pain.
Sure. And again, even mental health issues can cause chronic pain, correct?
Oh yeah.
Okay.
Sure.
And so what are the most common treatments for chronic pain?
Well, of course, there's over-the-counter medicines. There's non-steroidal anti-inflammatories like ibuprofen or naproxen, Motrin or Aleve, Tylenol, and traditionally opioids. They've fallen out of favor a lot, as you know, in the news.
Sure.
So they're a lot harder to get than they used to be for chronic pain, and they can be very effective. Come with a lot of side effects too.
Sure. Yeah. So and medical marijuana, of course, chronic pain is one of the qualifying conditions. So medical marijuana is obviously a treatment option for chronic pain. What can medical marijuana do to help treat chronic pain?
Well, we were talking about how the pain distracts from your life. And the most common answer I get when I ask patients is that the marijuana distracts them from the pain and it no longer occupies the center of their attention. And they can get about doing what they want to do without having the pain draw them back and keep them from participating in life. Like yesterday, I had a patient who's lost 100 pounds when she started medical marijuana because she's able to exercise again.
Wow.
And things like that, it's really a rewarding job.
Yeah, I can imagine. I mean, somebody that's able to be active again, just the joy, I'm sure,
And I had a
it feels
doctor,
like you get your life back.
yeah, and I had a doctor that prescribes medical marijuana as a patient, and he has it for pain. And I asked him, well, does it
Mhm.
help your pain? And he said, think about your patients. 100% of my patients say that it helps their pain. And I had to think about that. And he's right, probably maybe 99.9%, but
Sure.
the vast majority are really happy with this medicine for their pain.
That's amazing. And so, how does medical marijuana differ from other treatments for chronic pain?
Well, I'd say the big thing is, first of all, it's not covered by insurance, it's cash only.
Yeah.
So that's a one difference. And the stigma associated with it too is a problem, because it was, made totally illegal in like 1935, and in med school, while I was trained, it was only a drug of abuse. It's changing now, but slowly, and there aren't, the federal laws are still, marijuana is still illegal.
Mhm.
So the only research that can be performed is on marijuana that's from one farm in Mississippi. And apparently that's not very good marijuana. So most of the current research comes from Israel and other countries. So that's an issue too. Just we need more
Sure.
research. And,
Yeah.
the big things about the difference, I guess, of the stigma and the cost. And I can't really address the pharmacology of how the difference is. It's pretty complex.
Sure. Are you noticing though that there's a difference in side effects at all?
Totally. That's the one thing that most patients like, is that they don't have the constipation and the brain fog that they get from the opiates.
Okay. Yeah, I forgot about that part of it. Are you able to help? I know medical marijuana is one of those things, because we need more research. It's one of those things that there's not really like a dose that you can necessarily prescribe and say it's this precise, measurement and this precise product. But are you able to help patients kind of experiment and figure out what kinds of treatments work for them?
Yes, we can point them in the right direction. And a big resource is the people at the dispensary. A lot of times the people that work there have cards themselves, and they know what's worked for them. And they have patients coming back all the time, so they know what's working for other patients with specific conditions.
Mm-hmm.
So that's very helpful.
Yeah.
It's an interesting medicine because the patient has all the power with this medicine. They decide if they're going to take it and when and how often and what form and what dose. And you can't overdose on it. There aren't any receptors on your brainstem or heart or lungs where you're going to shut your breathing down or anything. If you take too much, you're going to sleep longer than you wanted to. But otherwise, the patient has all the power with this medicine. And so I think that threatens a lot of doctors, because we don't say exactly how to take it, when and where and how much and so on.
Yeah, so actually that seems to be the theme with everybody that I talk to about using medical marijuana to treat their conditions, is it's about kind of getting control of your own treatment plan again.
Yes.
And it helps patients to actually improve even further than they would with just a regular, going to the doctor and getting a prescription and leaving, because they're able to be more proactive, and then they become more active in their plan.
Yeah, exactly.
Yeah,
it's very freeing for the patient. A lot of freedom there.
Yeah, that's excellent. Do you have any advice? I know that there are probably people watching that are like, well, I don't know if my pain's that bad, or and maybe it is. It's affecting their lives, or people who are just nervous about the idea of taking medical marijuana. Do you have any advice for people who are hesitant?
Well, it's becoming more accepted now. And I would say, if you're having pain that's distracting you from what you want to do, give it a try, because there are a lot of ways to use it without getting high. A lot of people are concerned about the psychoactivity, but you can adjust the CBD to THC ratio and minimize the psychoactivity. And there's topical forms. There's just a lot of ways to use it without getting high. And it's very, very good medicine. This is the most rewarding job I've ever had as a doctor. to be
Well,
honest.
that's great to hear. And actually, you brought up topicals, which they're a product that we don't really actually focus on too much when it comes to using medical marijuana. So can you tell me a little bit about how topicals are effective in treating chronic pain?
They're very good for focal pain, like one joint. For example, my wife had her knee replaced, and she uses a cream on her knee, and she swears by it. But to be honest, about half my patients respond really well to topicals and half don't. But if you respond really well.
Okay, and you still need a prescription for medical, or a recommendation for medical marijuana if you are, okay.
There are some preparations out there without a recommendation, but you have to have usually a whiff of the THC to make the pain relief effective.
Okay, excellent. That's good to know. Well, Dr. Cornell, thank you so much for taking the time to share your expertise with us. We appreciate the information. And once again, I'm Jennifer Betts with Ohio Marijuana Card. This is Dr. Cornell with Ohio Marijuana Card. And if you are experiencing chronic pain or any of the other 21 conditions that apply for medical marijuana, give us a call or visit our website at ohiomarijuanacard.com and schedule an appointment to talk to a doctor.